Hello everybody, my name is Katie. Welcome back to my channel, and for today's video I have another day in the life of PGY2 Pediatric Pharmacy resident. This rotation is going to be PICU. It's my second rotation of the year at my residency site, which is a 16-bed level 1 PICU that is a 5-week core rotation, meaning that it is required for all residents to take. So yeah, that's pretty much the background. Also, I have my computer down here with notes, so I will be kind of referencing that and looking up and down, so that is why. But let's go ahead and get started. So today is Friday, October 3rd, and it is my day of, it is my day 12 of 12. So I am currently exhausted. And usually I wake up at 5:45. Today I woke up early. Tell me why, I don't know the answer. But I had my hair in braids last night. So I did that because I wanted to have wavy hair to look nice for an event later tonight. We'll get into that in a little bit. But yeah, I brush my teeth. I get dressed in my scrubs, just like normal. And then I tie my hair in a bandana, which I've been getting off of Amazon. And obviously, I'm loving them. But yeah, so for breakfast, honestly, kind of low on food because it's my day 12 of 12 and I didn't have time to go grocery shopping. So I had makeshift breakfast of toast and jam, strawberry yogurt with granola, and then like a raspberry lemon juice. So very makeshifty breakfast, but I made it work. And then I packed my bag. Today I had the addition of normal people clothes with my laptop, which I usually bring. And then I fill up my water. I grab my granola bar because I know I'm gonna get hungry in a few hours because the breakfast I had was not really like a full breakfast. But I leave my house around 6:30 in the morning because my shift starts at 7. And I generally park around 6:45-ish, depending on, there's not really too much traffic because my drive is very short. But then I head straight to the resident's office to drop off my stuff and pick up my patient safe phone. And then I walk to the pediatric office from there, and I settle in at 7 to start my shift. So I log onto my computer, I unforward the phone in the office from the main pharmacy to us, because overnight covers. Also, look at this little cute guy on the desk. Isn't he adorable? But yeah, so I print my patient list. Today we had 7 patients. I will say this rotation was kind of a wide range of patients. I've had anywhere from 1 to 13. So today was somewhere in the middle, kind of on the heavier side, which was good to end off the rotation. But I log on to Theradoc and I check my consults. So we had a vancomycin continuing from yesterday and an anticoagulation monitoring prophylaxis for Lovenox for a 13-year-old that was obese. So we did kind of like a makeshift, like adulty surgical type dose for him, even though he might have more pediatric kinetics. So we just wanted to monitor anti-10A in him. But anyways, then I check the orders in the queue as well, make sure there's nothing from like overnight that got left in there or rejected, and kind of figure out what's going on there. And then I just work up patients, verify my orders, kind of go back and forth between those. And then for orders, I'm responsible for PICU and then one of the general pediatric floors because there's 4 of them. Gen Peds takes 3 of them and PICU takes PICU and 1 of them, just to kind of even the load a little bit more. And then I actually got a Teams message for a conditional order from the overnight pharmacist, which we do not do conditional orders. So I handed it off to the general pediatric pharmacist when she got into the office that day, since they get in at 8, so they come in a little bit later than we do. But I just went ahead and verified the first part and then handed it off to her basically so she could follow up with the provider. But rounds for PICU generally start around 8:30, so I just continue to work until around then. Actually, this last week of rotation for me, I had a PGY1 resident with me, so one of my co-residents, and that was really good. So we attended rounds alone, just us 2, and we had kind of like a layered learning thing going on, which was super fun and super awesome, especially since I do want to be a preceptor and I'm doing a precepting rotation at the end of my residency year as well. So it was kind of like a good taste into starting with that. But rounds did start a little bit later today than usual. They started at 9. later because we were transporting our Vanco kid. She had mets to the lungs, so she's getting eval for radiation at a different hospital. So rounds kind of got postponed a little bit because of that. But on rounds for PICU, it's multidisciplinary, lots of different providers. There's like the MD, so like the attending, PAs, medical residents. There's also a student shadowing parts of this week as well. And then obviously pharmacy, and the nurses. So just great collaboration with everybody. Personally, I didn't have anything to bring up today as for like interventions wise, but like I was asked about antibiotic dosing and choices for our kids. I gave my recommendations on that. And on rounds, I verify orders as they come through. Sometimes they ask me to put them in, or sometimes I verify it for them, kind of depending on like who the provider is, what the order is, what their preference is. But yeah, so kind of work on orders throughout rounds. Today they ended a little bit after 10. There was a different kid who went to MRI, so we kind of had a little bit of a pause in the middle of rounds. And I got hungry, so I had my granola bar during that pause. But yeah, kind of depends on the length of rounds depending on the attending, because some people take a little bit longer than others. Some people also like to teach, which takes time, which I love. Like I love attendings who love to teach because I learn a lot of things that are like not pharmacy related, which is super cool. But today they ended like after a little over an hour. So then I went back to the pediatric office and had some cookies. One of the pharmacists baked them, and so we had them and they were really, really good. So it was like a good little pick-me-up snack. And then I finished Theradoc and continued verifying orders. And then I had lunch around 12:15. So I went to the cafeteria with my co-resident and I got some sushi from a vendor. It was really good. And then I returned after my 30-minute lunch for my patient case presentation on Wellbutrin overdose. The time after lunch basically is a time for like topics, presentations, etc. And that counts for me, but also like the PGY1 resident. There was also a student that was there as well. So we all kind of like did these together and learned from each other. And then it was more opportunities for me to participate in layered learning as well. Overall though, in this rotation, I did have 20 topic discussions and 12 patient experiences this rotation. So slightly less than general pediatrics if you watch that video. But still quite a bit. So for patient experiences, kind of like I mentioned in the last one, these are things that you're gonna see, or you're definitely gonna see on a PICU rotation. So these were things like sedation, analgesia, status epilepticus, DKA, sepsis, etc. And we talk about those patients specifically and what we did and kind of like guideline recommended like therapies and things like that. But yeah, that's pretty much what it is after lunch. It's just topics, orders, and consults pretty much. And then just to kind of finish off the rotation aspect of it, I think the most notable thing this rotation for me is that I looked into a patient with many medications, like a lot of medications. And she was having dystonic movements. And so I was kind of looking at all of her medications, trying to figure out what could cause that, if there's like any interactions, or if it's like, you know, just kind of what's happening. So I did find a case report showing oromandibular dyskinesia in patients a few months after taking tramadol. And everything actually lined up like perfectly with like the length of taking it and things. So I recommended to the provider that we start like weaning her trazodone off. And then actually we did see notable improvement in her sleep and dystonic movements the night of the change, which was super, super awesome. So I think that was the highlight of the rotation for me. But yeah, so normally I get up at 3:30 since it is an 8-hour shift. However, today I got up at 2 p.m. Because we have a resident well-being bonding event with all of the like hospitals under our institution. Residents, that I should probably clarify, the residents at all of the hospitals under our institution, and it was very, very far away. So we got up early. And then Chili's was quite literally next door to the place. So we went to Chili's, we as in like the PGY1 resident on rotation with me, and then everybody else who also got there like after us, which is actually most of like my hospital's like residents, which was super fun. So we chilled at Chili's for a bit. We tried the Witch's Brew like October margarita, got some chips and salsa. Was a good time. Then we went to the pasta place, which was like literally next door, super awesome. So then we did that and we met up with the other residents at the other sites and we talked with them. And we made pasta. So we made fettuccine with chicken and then 2 different sauces, so Alfredo and marinara. And then we also made some garlic herb butter for bread. And then the RPD, like I guess my RPD, but like also management, went out, and she actually bought wine for all of us to have like a wine and pasta dinner night. So I don't know why I did this, but a wine and pasta dinner night. So we had that. It was a super, super fun time. After we ate it, or after we made it, we got to eat it. We also got to decorate cupcakes. It was good. And then we drove home after that, and I got home a little bit before 9 p.m. I took a shower, I relaxed on the couch because I was tired. I just finished my 12 days and I had a social event, so I was just, and then I flossed and brushed my teeth, and then I went to bed at 10:30 and passed out and had a great night's sleep. And that is all that I have for you for this week's video. I hope you enjoyed it. If you did, please make sure to give it a thumbs up, subscribe down below to stay tuned for all of my other rotations that I'll be having this residency year. If you're just interested in rotations in general and you found this video first, you can go ahead and check out the other ones on my channel. I have playlists. I was a PGY1 resident last year, just general acute care. And then I was also a student, obviously. So I did a lot of rotations, like different random rotations my student year. So feel free to check those out. But that is all I have for you. And I will see you back again next Sunday for another video. Bye.